So we just have three very, very basic objectives of our journey, and I think some of them have kind of been touched on today. And the most important one, I think, is developing that community-based perspective of what HIV and AIDS is within the Aboriginal communities. And that context has already been set today with several wonderful stories from Dwayne and Bob's personal story, and that's what we're hoping to work on getting from our journey, is more of those stories and more of those perspectives on HIV. As well, we're really looking at building some evidence-informed capacity building within the communities. And one of the ways that we're going to do that is by helping to build research partnerships with the Aboriginal communities and involving the Aboriginal community in taking part in research. So that's exactly what you guys are doing today. You're involved in part of a journey that's been built up over the last 9 months, and that's going to continue probably for many years. And it's really important for it to be a continuous process where we build on information and bring in new positive people and build on the strengths that we have. So those are our three objectives of our journey. All right, so we started in March of 2009 when Ray came and approached the college, because we have a health research collaborative here where Scott brings together teams of students and faculty and community members and anybody that wants to be involved in helping create some new perspectives on a health issue. And so that's what we've been trying to do for the last 9 months. And our journey has included several different conversations. Every one of our get-togethers starts with an opening and a closing sharing circle, in which we pass around a grandfather rock, and we just talk about how our days were, or something that we're feeling challenged with during the week. And those sharing circles have been really important during our journey. We've had over 10 ceremonies, so sweats. We've had smudges and pipe ceremonies, and those have been as important, if not more important, in this journey to everybody, I think. And they've been a really, really important learning experience for everybody involved. We've had over 15 conversations. Just come to check out the presentation. We've had a knowledge cafe that brought together all of our stakeholder groups and just gave us a basic idea of some of the stuff that was happening in our communities already, some of the strengths that exist, and some of the things that we needed to work on. And within this journey, we've involved over 30 people and had discussions along the way. So our Knowledge Cafe, we had 4 questions that were developed in collaboration with all of our stakeholder groups. So everybody sat down and over emails and through discussions, we decided on what we wanted to talk about at this Knowledge Cafe. And a lot of the things that we talked about already today were brought out of the discussions. A lot of stuff about stigma and discrimination still existing within communities, and the fact that we need to work on overcoming that still. But there's also positives that came out of the Knowledge Cafe. The fact that there's already culturally competent services out there that are working, but we need to make sure that those that we build upon those strengths as well.